Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst, and my co-host, Farideh.
Hey, guys. Farideh Golombieski. I'm a nurse practitioner at RevitalyzeMD, and we're here today to talk about thyroid.
Thyroid, how we might differ from traditional medicine or regenerative medicine and functional medicine differs in how they test thyroid. So it's a great topic, and it comes up every day in the office. And we do thyroid testing of all of our patients that are being tested for wellness or hormones. And
Absolutely. It's a great screening because sometimes we have patients that come in and they think that one thing is going on, and they may have some underlying stuff like thyroid going on, because thyroid can encompass a huge amount of symptoms that sometimes people don't realize are thyroid related. So we always screen to rule that out and to make sure that we're effectively treating our patients and hitting all aspects of their health and wellness.
And in fact, if you could think about almost anything vague that you could complain of, it could be thyroid. And so we'll go through some of those. But again, when you go to your primary doctors, a lot of times what they're doing is doing some screening, and TSH is a frequent screening done. And traditional medicine, and sometimes that isn't going to show a thyroid abnormality. And in fact, you need to do a test that involves a more active hormone like free T3 and not even free T4, which is sometimes traditionally tested. So the two traditional tests you'll frequently see with your primary care doctors are a TSH and a free T4, if anything. But we also add a free T3 onto that. And there's some other tests you can do as well if, say, you're not responding or we haven't figured it out yet. So
Exactly.
But the big thing is again, normal. So let's talk about normal. Nobody wants to be normal, right?
And we can be normal and still have symptoms. So I think that we put everything in these really nice boxes, right? Like if you fit between this number and this number, you're normal, and your symptoms or something else, right? How many times have you gone and said, I'm tired, I'm run down, I'm this, I'm that, and it's, oh, well, we put that into this box. Here we go. Out the door you go. So normal is pretty relative, because we can be normal but still have symptoms and have something going on with our bodies that we know is not right, that we want checked out. So that's when we get into the conversation of optimal. And I think that's really how functional medicine, traditional medicine, wellness clinics, how they really vary. A lot of times primary care, traditional medicine is normal levels, right? If we're between X and Y, we're done. Where with us, we're looking for optimal.
We're looking for optimal. And then what is
symptom
normal?
resolution?
Like, a lot of times those normal ranges are based on a subset of patients that isn't anything like the patient that's in front of us. And so again, normal can be a small study of patients and what's, the average, and then the normal, two standard deviations above and below. That's still a normal range, but is that range applicable to the patient in front of us? And so that's where we kind of look at the upper end or optimal range, or sometimes it's a number range outside of that based on some studies. And we really want you to be optimal, because you can have, like Farideh said, a subclinical or a normal range symptomatology with thyroid issues. So
we do. As we check a TSH, your thyroid stimulating hormone, that kind of encompasses all the hormones, right? So that's a good general screen that a lot of times, like Dr. Durst was saying, will be normal. And you really need to look a little bit further. You need to look at your active hormones underneath of that. So the most common that we hear about is T4. What we don't hear about as commonly, which we really should be looking at, because it really is the most active hormone, is T3. And that's really what we screen in our office, because it is the more active thyroid hormone.
Yeah, and you really want to do that comprehensive, like where we're doing TSH because it's going to affect TSH if we're treating it, but free T3 is the more active hormone. So you definitely want to know where that number lies. And then what kind of symptoms? I mean, the symptoms that you can have with thyroid.
Large array.
Yeah, we can go into this for probably an hour in and of itself, but let's talk about one of the more common ones, weight gain. I mean, everybody, it's the metabolic center of your body, right? The thyroid is determining your metabolism.
Yes.
So if you have some weight changes, thyroid is definitely something you would think about.
Yeah. Fatigue is another one.
Yeah.
Again, because it's energy.
It's the metabolic center. So, and then brain fog, or, slow to respond. mood,
Yeah.
panic attacks.
Cold hands and feet. That's another one. Dry skin, dry, brittle, coarse hair loss.
Puffy eyes. Fluid retention is another common one. Constipation is something.
Poor sleep, insomnia. That's another one. Mood changes is another as well.
And menstrual irregularities. Pregnancy-related complications can be, and sometimes people have been to their GYN and have had miscarriages and have never even had their thyroid checked. And so that is another thing. Puffy face could be one that you might have.
Depression. And then we can see hoarseness, right? So there's another one in the voice. And then we can see clinical changes in other comorbidities like increased cholesterol, really low blood pressures. You can see some allergy issues. I mean, it really does spread pretty far and wide.
Skin, headaches. That's another thing. Fibrocystic breast disease. There's just so many different things that can pop up and be thyroid related. So again, I think that is a necessary testing to be done in the offices too. So we do that on all of our wellness and hormone patients because it's one of the hormonal, and it's a symphony of hormones. And so they all have to work together and balance each other. And so it's part of the testing. So what kind of test, again, you can do more comprehensive, but definitely a TSH and a free T3. You definitely at least want to see those numbers and where you are.
Absolutely.
And so those are definitely some that we're doing. And again, in traditional medicine, a TSH is frequent and a free T4. And so you're not going to see that active free T3. And so your hormones bind to proteins, and what's free, whenever you hear us talk about free, that just means it's active in the bloodstream, free to work on the receptors.
And circulating.
And so the receptors are more responsive to T3, and it doesn't require the energy that T4 does to work. And so there's so many different reasons why T3 needs to be optimized and checked, therefore. And we have a lot of patients that come to us that have had normal thyroid testing. They've been told they're normal. And, it's pretty common in women that they're pretty convinced there is something going on with their thyroid, but they keep being told that it's normal. And so the free T3 has never even been checked.
It's crazy because when you read the studies and you look at the research, and on this podcast, we have some studies linked in so that you guys can go and look at those yourselves and kind of see why it's important to have both those hormones, T3 and T4, and the support of them and the medications that we use. But it is surprising that we're not checking it more frequently, even in traditional medicine, because the studies and the science really does support looking at that.
And it
T3.
it hasn't changed in, the more than decade that, I've been doing and learning about it. So, but I will say that what's the most common thing prescribed, and what do people come in on is Synthroid or levothyroxine.
Yeah. Those are our most common pharma medicines. Those are synthetic. You can pick them up at your Walgreens, CVS, Rite Aid, whatever.
Yeah. So in levothyroxine, which is T4. And so if you have been on Synthroid, and most people have heard of Synthroid or levothyroxine, that's T4. So it isn't T3. And so that's the most commonly prescribed medication. And again, manufactured, can pick up at the regular pharmacies, but the combination products you can too, and are covered. And so some of the combination products that have T3 and T4 in them, they're usually desiccated, sometimes pork derived, but a couple different ones, like Nature Thyroid is one of them.
Armor Thyroid is another.
NP is another one. And so there's a whole list of them. And again, sometimes we'll have difficulties because one will be available, one will not be available. And that's all kind of a manufactured. And actually, I think a lot of it also roots back to the Synthroid and the levothyroxine, because that's been always promoted. And so these kind of aren't promoted. And sometimes there's some issues with manufacturing of these products.
Or insurance will cover Armor, but not NP Thyroid, or they'll cover NP Thyroid and not Armor. So those are little things that we work out in the office that are easy to take care of, but they are available at your regular pharmacies as well as compounded pharmacies. So sometimes we need to tweak that ratio of T3 and T4, even more so than what we can buy commercially. And that's where compounding pharmacies come in, because we can tweak those.
They can tweak the ratio.
Change up those ratios a little bit if we need to really hone in and optimize our thyroid.
So all of those products that we're talking about, those combination products, which are desiccated, which kind of means that's the way they're manufactured. And again, a lot of those are pork derived, and just minor variations in all those products, but they all have a ratio of 4:1. So you still have T4 in there. So it's a 4:1, T4 to T3. But Farideh's right. Sometimes we need a different ratio. And there's some other testing that you can do with thyroid that is beyond what we've already talked about, such as a reverse T3 and even thyroid antibodies.
Yeah.
And so if some of those numbers are off or the reverse T3 is high, then we need to vary the ratio a little bit so that we actually we have more of the T3 so that we decrease the T4, and therefore you make less of the inactive reverse T3. So it's a little complicated, but the bottom line is compounding pharmacies are necessary.
Exactly. And they can compound them to the ratio that is best to fit your needs and how you feel and your symptoms. And I think that's where we get away from in big pharma a lot, is that we kind of have this one size fits all drug, and that's just not how medicine is.
No.
We shouldn't all be on the same, because we don't all work the same. We don't all convert the same. So T4 has to convert into T3 to be utilized within the body. So again, why are we only giving T4 if we're not able to convert? There are things that can prevent that conversion to T3, or the effectiveness in which we convert T3. So giving T3 sometimes is the option.
And so in the show notes, there are some study links that talk about, again, how only patients that are on the combination actually feel better. And in some studies that also reveal that only about 2% of patients will actually respond to just T4, which is levothyroxine, or Synthroid, which has historically been prescribed only for years. And so that reason, like, again, go ahead and read into some of those studies so that you can see also that there's a lot of documentation supporting the combination of T4 and T3. Let's talk about some things that might cause a problem with your thyroid. And so there's some nutritional stuff that people can basically have in their diet that can cause problems, such as soy.
Yeah.
Soy is a big issue. Yeah. Yep. That will decrease your thyroid function. And so other things such as like mineral deficiencies can cause some issues, such as zinc, selenium. Again, iodine deficiency is one of them. If you even think about fluoride poisoning, and if you even think about bromide, like bromide in cars. So if you have a new car and all the products in there are releasing bromide, which is then going to displace your iodine from your thyroid. So there's all kinds of things in our environment that can cause thyroid issues.
Absolutely. Autoimmune thyroid issues is another one. Estrogen dominance in women can cause some thyroid issues, which is interesting. Adrenal fatigue. So we're talking about our adrenals. So another thing that can affect thyroid. So there are a lot of things that can affect thyroid outside of what we typically think about. It's not just aging.
And if I think of adrenal is your stress. So cortisol is your stress hormone. So if you think of anything that causes stress, anything, so excessive, like COVID stuff didn't cause stress for everyone, and fear will cause stress. And so lockdowns and isolation,
job loss,
or
changes.
Yeah. So there's lots of different things that can cause stress, but also prolonged illness, surgeries, again, inflammation in the gut, and again, adrenal issues. So anything that causes an increase in cortisol or stress can cause a decrease in your thyroid function. So that's always good to know. And so, again, how you would correct that is also correcting, again, stressful stuff, nutritional deficiencies, and then thyroid replacement when necessary.
Absolutely.
And so there's all kinds of, again, different ways to approach that. But levothyroxine or Synthroid alone is, if only 2% are going to respond to that period, then that's probably not the approach that we want to do.
I need to take a different option.
Yeah.
To diagnose hyperthyroidism, it's very easily diagnosed. You come in, it's a simple blood test. It's just getting the correct tests ordered. So if you're seeing your primary care, if you're out of state, if you don't come to this clinic, ask for them to draw a free T3 along with the other hormone levels so that you can get that extra piece of information. But that's it. It's a blood test. From there, you can, like Dr. Durst said, nutritional changes, diet changes, and then sometimes it is medication when needed.
And Hashimoto's or the autoimmune, so Farideh brought up autoimmune issues with the thyroid. And again, Hashimoto's is one of those. And autoimmune, when you start to think about autoimmune, think about things such as gluten or GI issues. And so taking gluten out of your diet, cleaning up your GI tract with, detoxing and detox programs. And, and again, we have some pretty specific medical grade detox where it's a 10-day, walks you through what you need to eat to just support your liver detoxing everything we're exposed to. So there's some simple things you can do with that. And then again, just decreasing your stress. And then, we will go ahead and prescribe what is necessary. And so if you came in on levothyroxine or Synthroid and your primary doctor feels pretty strongly about that, sometimes we'll refer you back there with recommendations, but we can also add another prescription such as Cytomel,
which is T3,
so that you can do that combination. Or a lot of patients, and it's a joint decision because you have a primary care doctor you're seeing, so we want to work with them,
never against them or in opposition. We definitely want it to be collaborative.
Yes. And so if we need to then, and they don't feel strongly, or we can reach out to them, or you can reach out to them, or we prescribe it if, again, it's just a joint decision made between us and the patients. And we can prescribe one of those combo products, or we can actually compound something if we needed to further alter, the ratio of T4 and T3. So hopefully that helps clear up a little bit of, of what we've been talking about basically with, I will say that, again, we talked about just a little, I guess, driving the point home that T3 is more active. It's about 5 times more powerful than T4. It doesn't require any energy to bind to the receptor. The receptor is more sensitive. So when Farideh talks about a one size doesn't fit all, this is a perfect example. If we're talking about physiology and receptors and cell health, everybody's different. And so you're going to respond different. So one prescription, one medication, levothyroxine fits everything is just, it's outdated. And we need to start, customizing therapies. And there is a study, in the show notes that will give you a little bit of support of how that's necessary now.
And to kind of kick back to what Dr. Durst was saying about detox. So T4 has to convert to T3, and that happens in liver and kidneys. So sometimes detox can help even with that conversion naturally as well.
And cleaning that up. And then T3 also has direct effects on the heart and the mitochondria. So when we're talking about energy, and if you have low energy and your mitochondria aren't working, your muscles are, you're weak, you're fatigued, you're not building muscle, it's because T3 is also needed for direct effects in on the heart. And it's actually, there's studies to show that they'll use T3 for heart failure too as well. So there is lots of information out there about T3 and really no long-term studies that support just use of T4 alone. So, yeah.
Absolutely. If you guys have any questions, leave them in the comment section. We love hearing from you guys. If there's anything we didn't talk about or anything specific you have questions about, we love to hear them.
Yeah, absolutely. And then maybe eventually we will get a couple patients on that kind of talk about their experience, with testing or frustrations with, traditional medicine and testing, and how, they've had symptom improvement with change in therapy. So it would be a good thing to have on. So again, hit the bell, subscribe, share with friends, and let us know anything else you want to hear about, because we're willing to deep dive into anything aesthetics and wellness. Thank you.
Thank you.